Yeah, I mean, I think the results in head and neck cancer at this ESMO were, I would qualify them along the lines of disappointing in terms of, the lack of positive studies in head and neck cancer. We just saw the BURAN study, which is a study using buparlisib, a PI3 kinase inhibitor in combination with Taxol versus Taxol single agent in patients who fail PD-1 and fail platinum-based therapy. The trial endpoint was overall survival, did not meet the primary endpoint. There was no difference between the arms, probably related mostly to the fact that the control arm overperformed in this trial compared to historic control. Why did it overperform when there are several factors, but certainly prior exposure to immunotherapy, which was not the case in the BERIL-1 study at the time, could have played a major role. And we know that taxanes interplay with PD-1 inhibitors in sometimes a drastic way in head and neck cancer. So that was a negative trial. Other studies really focused on trying to improve the responses and clinical outcomes by combining immune modulatory agents to single agent Pembrolizumab, which I remind you is the standard of care in first-line recurrent metastatic biomarker positive, PD-L1 positive patients. So we saw disappointing results with terigolimab, which is the TIGIT inhibitor in combination with Pembrolizumab. This study, the Skyscraper 9 study, was unfortunately a negative trial, so this will not move forward. We saw Aspen 1 and 2 studies which combined the CD47 inhibitor together with Pembrolizumab, and both of these studies essentially were also negative. So this agent, evorpacept, will not move forward. We saw also combination, albeit with another PD-1 inhibitor, retifanlimab, together with a LAG-3 inhibitor and a TIM-3 inhibitor, that also did not result in any meaningful differences in clinical outcome. So, I mean, there were though some encouraging studies. We saw the results of Amivantamab with as a single agent. This was one of the cohorts that investigated Amivantamab in different settings, and those were in rather heavily pretreated patients with head and neck cancer after failure of PD-1 inhibitors, after failure of platinum, and we saw encouraging results with responses up to 40%. And so we also heard the announcement of the initiation soon of OrigAMI-5 trial, which will basically be adding Amivantamab. And I remind you, this is a dual inhibitor of EGFR and MET that has approval in non-small cell lung cancer. Makes a lot of sense to use it in head and neck cancer. And so OrigAMI-5 will combine it with Carboplatin and Pembrolizumab against the chemoimmuno arm of KEYNOTE-048, which is Pembrolizumab platinum, in this case either cisplatin or carboplatin, in addition to 5-FU. And so we look forward to this materializing and moving forward. I have to also remind you that this ESMO meeting happened after a major shift in the treatment of curable head and neck cancer with the proof in KEYNOTE-689 and the Nivo post study that perioperative immunotherapy in this disease makes a difference. We saw one trial using the same design as Nivo post, but with Pembrolizumab. This trial was enrolled mostly in Germany, and it did not reach the desired statistical difference between the Pembrolizumab and the control arm, probably related to the fact that there was quite a bit of patients with HPV positive disease where events did not happen. And so you could see the difference in HPV negative disease, but when you looked at the overall outcome, this was not a positive trial. Nivo post, I remind you, is a predominantly HPV negative trial. We also saw the CONSORT trial, which basically tried to build up here in the definitive setting, non-surgical setting, and enrolled patients mostly with oropharynx cancer with intermediate risk. Those are mostly HPV positive, but also included high risk HPV negative. The trial was also negative, did not reach a statistically significant difference. It used durvalumab prior to chemoradiation and following chemoradiation. So again, the lack of events in the HPV positive disease probably led to the negative trial. I have to remind you though that durvalumab is a PD-L1 inhibitor, is not really a PD-1 inhibitor, and did not have really a successful story in head and neck cancer based on prior studies. And so we look forward to the results of ECOG-ACRIN 3161, which is a trial that completed accrual and accrued about 630 patients with a maintenance nivolumab versus observation in this trial. So that will take a little time to read because also events in this disease, in HPV positive disease, do not happen very quickly. And that was basically a brief snapshot of ESMO 2025.